hard-boiled egg is nature's Ozempic. If you eat 3 of those a day, you're probably not going to need Ozempic because your appetite's going to go down. Eggs are high in they contain fat and protein. They contain very little of the bad carbohydrates that we talked about. So they're almost a perfect food. So
another lie which has been perpetuated is the relationship between heart disease and dietary saturated fat. Can we talk about fat being bad or not? Can we talk about cholesterol and specifically LDL cholesterol? Because the narrative on that is that it has been bad. Your thoughts?
Yeah. Well, first of all, cholesterol, when I was growing up, my mom was a dietitian. So I was immersed in health dietary recommendations, the food pyramid, and all this stuff. And at the time, it was believed that eggs, because of their high cholesterol content, particularly in the yolk, should be avoided. And we ate egg white omelets, and we limited the number of eggs we ate just because of that. Well, today, it's now been recognized, even by the most conservative elements of the medical establishment, that dietary cholesterol does not affect blood cholesterol. So you can eat as many eggs as you want, in my opinion. In fact, I consider eggs to be one of the healthiest things that I can eat. It's almost like a hard-boiled egg is nature's Ozempic. If you eat 3 of those a day, you're probably not going to need Ozempic because your appetite's going to go down. Eggs are high in they contain fat and protein. They contain very little of the bad carbohydrates that we talked about. So they're almost a perfect food. So eggs now could be eaten, but interestingly, many people and even many of my colleagues are still not aware of this. They still, say, "Oh, well, avoid eggs for your heart," and that's just not true. Now, as far as that's dietary cholesterol. Now, as far as serum cholesterol, LDL has been a target has been a target of managing heart disease because why? Because we have a pill that makes LDL go down, that lowers the LDL. And that's, of course, the large class of drugs that we talk about called statins that are one of the best-selling drugs of all time. And they're prescribed ubiquitously. And as we get into the book, we sort of peel back the layers on statins and LDL cholesterol. And that is statins, have an improvement in heart disease, in decreasing heart attacks. And hey, if heart disease is the number one killer, I'll take anything. But it's a small effect. It's only 1%, but I'll take 1% even. The problem is the benefits are exaggerated. Many advertisements and physicians believe it's about 30%. So the benefits are actually much lower. There's 1%, but still 1% is good. So the downside of statins is there are a lot of side effects, and these include leg pain, brain fog, depression, suicidal ideation, to the point where if you look at patients who take statins in some recent large studies, the people who take statins have fewer heart attacks. So they have fewer deaths from heart disease, which is great. Again, I'll take that. The problem is a disturbing factor is when they analyze what's called all-cause mortality. In other words, patients who had statins, their all-cause mortality didn't change. In other words, overall, they died at the same rate as other people. That meant that something else went up, right? They had fewer heart attacks, but they had more suicides. They had more traffic accidents. They had, which doesn't make sense other than the fact possibly lowering LDL cholesterol has effects like on the brain. Our brain is made up of cholesterol is one of the major components. So when we lower the cholesterol, there are, some of the side effects there. So there's a lot we don't know about that, But yeah, LDL cholesterol, people have pointed out that most people who come in for a heart attack have normal LDL cholesterol. So it doesn't appear to be the strong risk factor that we used to think it was. Even though we have a pill that will take care of it, it's not, as far as what we call hazard ratios or risk contributing to the disease, LDL cholesterol is very low. What does contribute to heart disease and my risk of dying of a heart attack? Well, things like HDL cholesterol, which is the good kind of cholesterol, I want that to be as high as possible. Triglycerides, I want those to be low. And HDL cholesterol and triglycerides are associated with metabolic disease, which are affected by our lifestyle and our diets, and insulin resistance. Insulin resistance is a much bigger risk factor for heart disease than LDL cholesterol. What does that mean? I'm much more likely to increase my risk of heart disease by eating a donut than by eating a steak. Something high in carbohydrates is going to be worse for my heart than something high in fat and protein like a steak or a hard-boiled egg. And this message, I think, is still not reaching people. As you say, people still fear saturated fats, LDL cholesterol, and these things in our diet, when I think I believe, and we show evidence in the book, that the real dangers are things that disrupt our metabolism related to carbohydrates and metabolic disease.
You mentioned hypertension already. Can we talk about another lie in the book which you cover? And this is in relation to high blood pressure, in that the lie that we're told is that blood pressure can only be treated through long-term drug use, and you believe that is not the case.
There are studies that we reference in the book that pretty much document this. And to be clear, I'm a physician. I'm not advocating anyone stop their medicines, whether it's insulin or blood pressure medicines, or really any medicine, without doing this in consultation with your healthcare provider. But what I'm saying is, through choices that many people aren't aware of that we can make in our lifestyle, it is possible to change our health so that we may not need these medicines like we did before, or maybe not need them at all. And we talked about diabetes. Well, the same is true with hypertension. There are great medicines for hypertension, and make no mistake about it, hypertension is deadly. It's a silent killer. It has very few symptoms till later. And medicines acutely will protect us from high blood pressure, which damages us. But long-term, just like so many of the other pills and surgery for these chronic diseases, the underlying root cause of the hypertension continues to progress. And although the blood pressure is under control, the damage to the blood vessels may continue on. So what I did, I had hypertension, and I went through some changes in my lifestyle, and I was able to reverse my hypertension to the point that I no longer needed these medicines. And I went through with my doctors a process of de-prescribing, where we stopped these prescription medicines, and I was able to control them by addressing root causes in lifestyle that really the book is all the book's about.
If you enjoyed that video, I know you'll get some value from this video right here.